Hi, human metapneumovirus. This has been immensely in the news lately, and I have received just in today's day about a dozen calls asking me, Dr. Roy, is there going to be another lockdown in the near future? Are we going to go back to the COVID-19 pandemic days again? So here we are with this video on human metapneumovirus, what you need to know, what you need to do. I'm Dr. Sitesh Roy, your allergist, immunologist, and asthma specialist, coming to you with this special video. So human metapneumovirus, friends, is an old virus. It has been estimated to be around since at least the 1900s, was first named in 2001 in Netherlands, isolated from around 28 babies there. So it's a very old virus that has been around for a while, and has always been known to affect children below the age of 5, with the highest peak of infection between the ages of 6 months and 12-month-old babies. So this is a very old foe. It is not a new infection. Also, it has been known that as kids grow to about 5 years of age, most of them have become immune because they have been exposed to this virus. However, children older than 5 years of age and adults can also catch this virus and get sick from it. Interestingly, this virus causes the maximum what we would call morbidity or health issues in very young children below the age of 1 and in the elderly who are above the age of 65 years of age. Also, people who are immunocompromised or people who have asthma or COPD are also at increased risk of problems with this infection. This infection is very hard to differentiate from the common flu, where a person may get fever. Sometimes the fever can get quite high. They get runny nose, they get nasal congestion, they can get coughing, they can get body ache or headache. So it behaves like any other viral infection. It can affect either the upper respiratory tract or the lower respiratory tract or both. And in most cases, it can affect both. Most people will recover from this virus naturally through just supportive care, which means taking care of the fever, hydrating oneself well, taking rest. But as I mentioned, certain groups of individuals need to take greater care. Now, human metapneumovirus runs parallelly, and it has its highest incidence of cases during the winter months. This has again been known for many years now, that in the winter months, two viruses, one called RSV, respiratory syncytial virus, and the other called human metapneumovirus, both parallelly cause a lot of children to get infected, and maybe even 5 to 10 or 15% of kids getting hospitalized because of this. And as older people get it, the infection may range from a mild cold or flu-like illness all the way to having a walking pneumonia and even a hospitalization if someone is elderly or has an immune compromised state, such as being in the midst of cancer therapy or being on dialysis or having heart disease that is chronic and severe, or other types of organ failure. These people can be at more risk if they catch the virus. Now, recognizing that it's an old foe, why is there so much of a hype about it now in media? The reason being that people are assuming that all the hospitalizations with the winter viruses in China are being driven by human metapneumovirus. However, the data released by the Chinese medical authorities so far seems to say that about 10% of the hospitalizations that are occurring are due to human metapneumovirus, which is higher than the influenza, parainfluenza, RSV, and other viruses that co-circulate at this time of the year. But it is still not at a level where we would need to be concerned that some kind of a sudden mutation in this single-stranded RNA virus is going to cause some major issues amongst humans. There is, however, a very big lesson for us to learn in this, and that is we stopped thinking about our immune system once COVID went away. We again started living a lifestyle where we are not taking care of our diet, our sleep, our exercise. We are not looking at the way we are taking care of ourselves when we are traveling. And with this, we give the virus a great chance to spread freely because it is spread by aerosols. by airborne transmission and through fomites, which means objects that a sick person has touched and then a healthy person touches and happens to touch their eyes, nose, or mouth, or happens to eat with that hand without washing their hands or sanitizing their hands, and the virus will spread to that person. There is an incubation period of around 2, 3, or 4 days, after which the symptoms will develop, including fever, cold, cough, and everything else that we know regarding these viruses. It is very important to seek medical care and medical advice if you are in a state where you think that a respiratory infection could get worse or your immunity is not at its best. But what I really think needs to happen is people need to be careful about being in crowds, about wearing a mask, about washing their hands and sanitizing their hands, and in general about their diet, lifestyle, sleep, adequate quantities of sunshine where available and as much as possible, and making sure that you are taking your regular influenza vaccinations and other vaccines that are there. As of now, there is no human metapneumovirus vaccine that's available. However, there is research going on, and maybe in the near future we will have a vaccine, but they're still in phase 1, 2 trials, and there is still some time before any vaccine is available. So, friends, bottom line is do not panic. This is not a reason to panic. It's a time to wake up again, recognize, are we doing enough to take care of our immune systems? And if we are not, then we should do that. And are we doing enough to protect ourselves if we are going into crowded places or traveling amongst big groups of people, to protect ourselves from any kind of viral insult? Doesn't have to be just the HMPV. It can also be, as I said, influenza, para-influenza, RSV, there are many other. Rhinovirus is another common cold virus. So we need to protect ourselves from all of that. So friends, till the next time, take care, stay safe, wear your masks, wash your hands. Until the next video, God bless us all.